CDC vaccine advisors will meet tomorrow to decide on whether to recommend the FDA's authorization of booster doses of Moderna and Johnson & Johnson's COVID vaccine. News 8's Regina An shows us what people need to know about getting another dose.
The FDA says regardless of which vaccination you received first, if you're eligible for another dose, you can get a different brand from the one you originally received. Similar to the Pfizer vaccine, the FDA authorized a third Moderna shot for adults who were vaccinated at least 6 months ago. Those eligible for the booster include people 65 and older, people with underlying health conditions, or are at risk of frequent exposure to the virus. For people who got the Johnson & Johnson COVID vaccine, anyone can receive a second dose at least 2 months after their first shot.
If you got a Johnson & Johnson vaccine, you do get a bigger boost in your antibody levels if you get the Pfizer or Moderna vaccine as your second dose.
This coming as the White House is ready to ship millions of doses to the 28 million kids ages 5 to 11 in anticipation of emergency use authorization by early November. The plan is to work with pharmacies, schools, and health clinics to distribute the vaccine.
Kids have different needs than adults, and our operational planning is geared to meet those specific needs.
Local parents say they are supportive of that idea.
I feel great about the vaccination.
I would definitely, if it is approved by the FDA, I will definitely vaccinate my son. He's the only one not vaccinated. Of course, my baby is there.
Federal regulators will meet over the next 2 weeks to weigh the safety and effectiveness of giving low-dose shots to the roughly 28 million children in that age group. The CDC says 6 million U.S. children have been infected, and while children run a lower risk than older people of getting seriously ill from COVID, at least 637 people age 18 or younger have died from the virus in the United States. As for children under 5 years old, Pfizer and Moderna are studying their vaccines in children as young as 6 months old. We may see those results later this year.